Well, our sponsors at Roswell Park are doing their part in recognizing Breast Cancer Awareness Month by hosting their annual mammothon to encourage more women to get examined. If you or someone you know is hesitant to schedule their mammogram, you can listen in on my conversation with Dr. Poss from Breast Care of Western New York about why it's a good idea to make your appointment today. Breast Care of Western New York is a diagnostic and treatment center for breast cancer. Whether you need an exam, a second opinion, or surgery, the team here at this Roswell Park community practice will walk with you through every step of the way. And I'm here with Dr. Mariola Poss to tell us more about it. Thank you so much for bringing me here to your center.
It's great to have you.
I want to talk about first how long that you've been a surgeon focused on breast cancer and imaging.
So I've been treating breast cancer surgically since 2010. That's when I finished my training, and primarily just breast cancer since 2015.
Okay. Can you tell us a little bit about how mammography and breast imaging really help to guide and inform the treatment plan that you lay out for your patients?
Well, firstly, it makes us, allows us to make a diagnosis, right? So when you get your imaging, we know that there's an abnormality, then we know that if we need to biopsy it, and once we have that information, allows us to get you started on the appropriate treatment plan, which, depending how involved the cancer is, how large it is within the breast tissue and other surrounding structures, will help us decide, do you need medical therapy first? Are you okay to go ahead with the surgical treatment first? And then, allows us to decide which type of surgical treatment is appropriate for you.
That's right, because Dr. Poss, you are a surgeon, so the focus of today is really letting and informing the viewers know about how much of a teamwork effort the treatment care and plan goes into here with Roswell, right?
Breast cancer treatment is multidisciplinary, meaning that most women and patients, because men get breast cancer too, of course, are going to see more than one type of physician. We all have our own area that we address, and that generally includes a surgeon, a medical oncologist to help with the medical therapy, and a radiation oncologist as well. So we have all those team members through Roswell, and we often discuss cases together to allow to plan for the best treatment for an individual patient.
Can you tell us about some of the exciting advancements when it comes to imaging as far as breast cancer?
Well, in terms of imaging, nowadays that we have 3D mammography, and that's kind of the biggest recent innovation, which really allows us to see more in depth within the tissue, particularly women who have dense, what we call dense tissue, which can make smaller things difficult to see on a regular mammogram. Now it's kind of like a scan where we can kind of see through little increments throughout the tissue, and allows us to find small abnormalities a lot sooner than we would have in the past.
Which is life-saving, right?
It is. Early detection, and that's what we always strive for, and this allows us to be able to do that, because the smaller and earlier a cancer is found, the more curable it is, and that allows for the best possible outcome.
And at what age should someone start thinking about going in to get their mammogram?
So we still recommend for average risk women at age 40, and certainly there are other factors that can go into that can have women be a higher risk, which could indicate they would benefit from earlier screening or more frequent screening.
Talk to me a little bit about the teamwork that goes into working with each of the different campuses, making sure that the communication is clear so that the patients get the best approach and care to their treatment plan as possible.
Sure. Well, once again, we work very closely with the other doctors involved in their care, including the medical oncologists, radiation oncologists, and having surgery at downtown Roswell affords us the benefit of our excellent surgical team of nurses and anesthesia providers, as well as the pathologists who actually look at the tissue from surgery, make the diagnosis, and that really is important, being able to then plan on the correct additional care that's required.
Well, Mammothon is all about making sure people go out there and get those screenings, but there's a lot of people that don't do it out of fear. So what would you tell to anyone that is eligible to get a screening, but they're afraid to go in for one?
Sure. I mean, we do have patients who we address these issues within the clinic. Some women are afraid that they were mammograms are going to be painful or uncomfortable, and I will say that nowadays the technology affords that really isn't the case. If you're afraid to go by yourself, I say bring a friend. You know, sometimes that's helpful. Maybe you know somebody else who hasn't had a recent mammogram or needs to go to, and having somebody there with you for that support, I think, can be really, really helpful, because that's the most important thing, is to allow us to have early detection, so that if there's something, it's better to know, so we can go ahead and get you on the best possible course moving forward.
Dr. Poss, thank you so much for your time and
Sure.
encouraging people to sign up for their mammogram.
My pleasure.
Roswell Park has a goal to help 525 women get examined by October 4th, and you can help our sponsors reach this goal by visiting roswellpark.org/mammo or by calling the 1-800-ROSWELL number on your screen.